We're back to the Neil Haley Show. My guest today is again Dr. Charles Simkovich of Simkovich Concussion Institute. Dr. Charles, thanks for stopping by and look forward to this conversation. As you've told me off air, okay, we've been talking all of these, some people would call miracles. I call them miracles, but I call, wow, it can happen and you've been able to do it. But we all know, even if we do miracles, we have to have research to prove them. And tonight you're going to talk about the research you have to prove what you've been able to do for 20 plus years.
Well, sure. When we were researching concussions and what went into them, we had there was no precedent. There was nothing out there really. 35 years ago, it was a really unknown territory. So we ran tests on everybody: CT scans, MRIs of brains, blood work. And we were checking, we referred to basic anatomy and physiology and what we knew. And the anatomy of this skull, in specific, the sphenoid bone. Now, this sphenoid bone is Grand Central Station, and almost everything runs through it. Like in the 70s, the Super Bowl ran through Pittsburgh. Houston had to go through Pittsburgh to get to the Super Bowl. Well, this same thing with the sphenoid. Eye muscles attached to it, the jaw muscles attached to it, cranial nerves pass through it. Even more importantly, it houses the pituitary, which is the master gland, which is also controlled to the hypothalamus. The hypothalamus, and then the pineal gland. So we're talking about cause and effect, but it was just my words. But to show what backs us up, here's a study done in the journal Pituitary. Traumatic brain injury induced hypothalamic pituitary dysfunction, a pediatric perspective. So this research goes on to say evidence from post-mortem studies suggests that the hypothalamus and pituitary structures are vulnerable to damage following head injury. Pituitary dysfunction present months or years after injury is now well recognized in adults. This article reviews the available pediatric data, which shows that hypopituitarism may occur in both mild and severe TBI, with growth hormone and gonadotrophin deficiency appearing to be most common abnormalities. That's a pretty intense study to show that there's more than just pain involved in concussions and cognitive problems. Here's another one in the Indian Journal of Endocrinology and Metabolism: pituitary and or hypothalamic dysfunction following moderate to severe traumatic brain injury, current perspectives. Recent data have suggested that pituitary dysfunction is very common among survivors of patients having moderate to severe TBI. I mean, the evidence is mounting that concussions cause a larger array of problems and health problems than previously thought. In Endocrine News, head cases, pituitary incidents arising from traumatic brain injury. Over 2 million Americans suffering from traumatic brain injuries each year. These incidents can often lead to pituitary dysfunction. And even more telling is more than 5.3 million Americans are currently living with lifelong disability due to TBI. That's a big number. So now we go on to, what does the pituitary control? Organic functions, hormones, blood pressure, pulse rates, heart rates. MedPage today: erectile dysfunction tied to concussion in former NFL players. Dose response link between concussion symptoms and low testosterone reports. I mean, this is significant. It's what no man wants to live with. But these are things that we're starting to discover and actually correct. JAMA, the Journal of American Medical Association Neurology: association of concussion symptoms with testosterone levels and erectile dysfunction in former professional U.S.-style hockey football players. So there's a lot. This is why we went the direction we went. Here's another one. In aboutlawsuits.com, concussion side effects may cause gastrointestinal problems. Study: new research points to a strong link between the gut and brain, suggesting that individuals may experience harmful side effects in the gastrointestinal tract after suffering a concussion or traumatic brain injury. In a study published in the November 2017 issue of the medical journal Brain Behavior and Immunity, researchers indicate that people who suffered a head injury or severe concussion also often experience long-term changes to their gastrointestinal systems. Researchers from the University of Maryland School of Medicine induced a moderate level of traumatic brain injury in some mice. The result indicate there is a distinct two-way link between traumatic brain injury and intestinal changes after head injury, suggesting that brain injuries may contribute to increased infections in affected patients. According to findings, people who experience brain injury are 12 times more likely to die from blood poisoning, which is often caused by bacteria. They are also 2.5 times more likely to die of digestive problems compared to those without brain injuries. Research said it is unclear how concussions cause the change to the gastrointestinal system, but it may be linked to enteric glial cells. Those cells are specific to the gut. However, astroglial cells, which are the glue cells in the brain,
Right.
are similar, but are located in the brain. Researchers speculate both cells may become activated after brain injuries. So that needs further research, but they're starting to look. Youth concussions increased risk of multiple sclerosis. This is a study.
Oh, man.
Following a head injury or concussions, teen may face a higher risk of developing multiple sclerosis later in life, according to findings of new research in a study published last month in the Annals of Neurology. Now, this is a little scary. In the new study, teens who suffered concussion had a 22% increased risk of having an MS diagnosis later in life. Additionally, their risk increased by 150% if they suffered more than one head injury during their teen years. A 2014 study found that teens who suffered concussions are more likely to develop emotional symptoms like anxiety and depression. Study authors point out the overall risk of developing MS is still low, but the risk is significantly higher than if a person never suffers a blow to the head. This is from the Annals of Neurology. Then we have the last one I'm going to point. Head injuries can cause mental illness. If you suffer a head trauma, your risk of developing certain mental disorders increases significantly, in some cases more than 400%, a new study shows. Danish scientists have studied the link between head traumas such as concussion and skull fracture and the subsequent risk of developing mental disorders. They found that head injuries can increase the risk of developing certain mental disorders by up to 439%. Largest study to date. This is the largest study of its kind, totaling 1.4 million people. By comparing the injured people's risk of developing the disorders with the rest of the study population, they found that those with head injuries were 65% more likely to be diagnosed with schizophrenia, 59% more likely to develop depression, 28% more likely to be diagnosed with bipolar disorder, 439% more likely to suffer from organic mental disorders. So what we surmised 35 years ago, that there was not much known and there was much to be learned, has really come to fruition. 35 years ago, when we developed the basis and the foundation for the treatments that we do, we actually thought, we discovered the Holy Grail, and we knew a lot. Well, when I compare today what we know compared to 35 years ago, we were infants, and the evidence and studies keep mounting and mounting and mounting. Now we know the problems that arise from concussion is getting greater and greater and more severe and more serious. Hence the treatment plan that needs to be done to help remedy and remediate the brain, which we've come a long way with that, as well as with the multiple patients.
Yeah.
We have. I just got a text from a lady. I treated her son about 8 weeks ago, and he had anger issues. He was beating up his sisters. He couldn't pass anything in school. He dropped out of school. He still didn't get his high school diploma. So she was real happy. She said he's just being very nice to his sisters, but even more importantly, he couldn't pass algebra for 2 years. He tried and he was frustrated. Well, in 8 weeks since he's been done, he took Algebra 1 and Algebra 2 online, passed them both with 100%. And he's already accepted into a college. So, I think we're well on our way to being able to help a lot of these problems
Totally.
that we've talked about.
It's coming. It's coming, Dr. Charles, and the best place to go is SimkovichConcussionInstitute.com right now. Following them all different social media platforms, Twitter, Instagram, Facebook, YouTube. Check out his shorts, all the different things. We appreciate Dr. Charles, and it was great information again today.
Thank you, Neil. Always a pleasure.
You're welcome. You're listening and watching the Neil Haley Show, and we'll be back in just a moment.